Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I'm the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thanks for tuning into the podcast. Glad you're here. Today, I'm going to continue with this long arc. This might be the longest series I've done yet. And it's just about Make America Healthy Again, the MAHA movement. Then, along with that, the MAMA movement, the Make America Medical Again. And just to understand it, because I'm in the middle here. Let me put it this perspective here. Once again, I'm a naturopathic medical doctor. In the state of Arizona, I'm licensed to perform, primary care. I perform surgery. I prescribe medications. I run labs. I provide care. I'm a full-on regular doctor. It's just my style of medicine as a naturopathic medical doctor is more grounded in lifestyle, more grounded in natural approaches to the individual. That doesn't mean I'm afraid to prescribe a prescription of some sort when necessary. No, I will do that when needed, absolutely. But that's not the first step always. And I want to be more clever than that. I don't want to be lazy and walk in the room and just jam out a prescription and walk out the room the other door and being highly productive with a throughput where I'm making a lot of patients walk through my office and making a lot of money. That's not why I became a doctor. I'm here for the feels. I had a patient last night. I called at the end of my day. And just a quick story about her. I've had her as a patient for 13 years. She's dear to me, her and her husband, just dear human beings to me. And we got some bad news back in several months ago for her. And her labs showed some significant issues around autoimmunity. And we instituted a couple small shifts in her lifestyle, and those autoimmune levels went away. Why am I saying this to you? Why I'm saying this to you is because that is still sitting in my heart today. That I had a woman who had her anti-nuclear antibodies pretty elevated. And I was nervous, and so was she. And knowing that we did something so honest and simple as a dietary change in her, put it in remission, that's why I'm here. I didn't come here to be a physician to make a ton of money, to show off something or to prove something. That never really grabbed me. It wasn't from an insecure place. It wasn't from a desire to take or make more place. It came from a place of wanting to be a part of something beautiful. And that's the relationship you have with a patient. I believe this. This is what medicine truly is the doctor sees the woman or the man in front of them as a human being and devotes themselves to that person's wellness. That is a calling. That provides something that no insurance compensation, whatever they call it, reimbursement can pay. That's priceless. To have meaning in your life, to have purpose in your life, to have a sense of connection. This is what it means to be a physician to me. And this is the relationship I have with my patients. And then it took me years to develop this. It took me years to build this, to grow this, to make it work. The systems that have to go into building a business around this are not easy. Not at all. Not at all. I was just talking to Evelyn about it. It's a lot of work to figure it out. I couldn't do anything else with my life other than this. This is it. This is it. This is the best. And when I've hit this place in my career, I looked up and I looked around to see what else is out there. And I see what my patients are being dragged around with. The two arguing voices of the MAHA movement and the current medical paradigm as it is now It's like, again, I like the saying for it because you're between the devil and the deep blue sea. The devil you know, the devil you don't. And it can be terrifying for them. It's terrifying for people out there. Today's episode, I want to go back and further discuss how medicine lost their patients. The current conventional medicine system lost their patients. Why is it that women are flocking to alternative providers now? And what are the risks with that? Because the other thing I want to let you know where I believe I shine in practice and where I believe medicine should always shine in practice is we're accountable to the patient for the effectiveness of our therapies. We're accountable to the patient to our abilities to help them. I deeply believe in accountability to our patients, constant accountability. And I think both sides miss that. And I'll explain why. But before I do, I want those of you out there who are on my podcast listening to it, who are in conventional medicine. I know you're out there. I know you guys, see this, and I get messages from you from time to time. Some are very kind and some are like challenging, and that's good. We should have a robust debate about the things I discuss on here because these are important things to talk about. But to you guys, I just wanted you to know, a problem I see in conventional medicine is that they believe that women are driven to alternative providers due to ignorance, due to a lack of intellectual capacity. And there are so many podcasters and allopathic or conventional, medical providers that sign on to that and believe that. I want you to know that's not true. That's not the truth of it. In a way, that's avoiding responsibility on the part of conventional medicine to say that. The reason why these women are going over there is because they don't know any better. Yeah, that's avoiding responsibility big time. Women go to alternative providers to the Make America Healthy Again movement in order to feel seen and heard and understood. They go there because, as my mother-in-law calls it, the smiling face in the crowd. You always look for a smiling face in the crowd when you go somewhere just to meet someone who's smiling. You look for someone, But that's what women are looking for because they have been so gaslit and they have been so poorly treated in the current system. Poorly treated. We can't argue that. We're beyond that now. Let's accept it. Women have been really abused by medicine for a long time. And so when they go to the alternative side, and I want you to know, conventional medicine, you are right to be worried about that. When they go to the alternative side, what are they getting? Is it really healthy? Is it safe? And you're right to be worried about it because I share that worry with you. A lot of times it's not. But what would drive a woman to go to that space of questionable science or questionable ethics? What would drive them there? And it really boils down to validation. When a woman presents to your clinic and she has issues around weight, and the only advice she gets is eat less, exercise more, that's not going to help them. It never did. And that advice that was being given to them for all these years only made it worse because it built shame, it built in dismissal to them, and now they don't even want to talk about it with you guys anymore. So where do they go? Online. A friendly face in the crowd. And these influencers sell hope and they sell connection. This is what they talk about. And what makes it not great, in my opinion, is that there's always a hook at the end of it where that influencer is selling a product. See, the thing is that when you're a care provider, empathy is one of your most important tools you have. And it's important to enter that space with profound integrity because empathy is a powerful tool. Once you show empathy, true empathy, patients become very vulnerable to you. And where it becomes a problem is when you walk into that space with someone with empathy, but you're using empathy as a marketing tool, a marketing ploy to get someone to buy your product. This is when it's not healthy and it's not good, because it's no longer about the woman in front of you and caring for the woman. It's a matter of I'm using empathy to hook her, to get her into my queue to purchase an item from me, and then put it on auto subscribe refill. And was that really the thing she needed? Again, women were driven to this due to lack of empathy from their care providers, a lack of being seen. How can we argue with them when they go into that other space looking for validation and being understood? You can't. And then telling them, well, that looks stupid over there. That doesn't work. That's actually diminishing. It's further demeaning them. It's diminishing your authority as a physician when you do that, if you even had any at that point. The only authority you get as a physician is the authority they give you. And even then, authority may not be the best word for it. I run across a lot of medical influencers in the conventional medical system who, just bash adrenal fatigue and subclinical hypothyroidism as different diagnoses that are not authentic and not real. And they bash the approaches that, alternative medicine takes in these arenas. And I want you to know, I don't disagree with a lot of the arguments that are placed by, the conventional medicine when they're concerned with people being diagnosed with adrenal insufficiency without lab work, or subclinical hypothyroidism without lab work. And I also share the concern when these women are being prescribed, supplements or herbs that are not well tested for potency, purity, et cetera, or not even tested on the other end. Did it actually do anything physically to you? Did it actually benefit you? I agree with those concerns that Western medicine has. And I see that as a good thing to debate and discuss. But the reason why these women are not listening to you is because you're not presenting it in that way. You're not presenting it to them in an empathic and thoughtful way. It's more combative. It's more anti that other doctor or that other provider that's out there. It's not empathic, saying, I see you. I see you having this moment of fatigue that's profound to you. I see you that you're having abnormal weight gain. I see you that your hair is coming out. I see you. And I know how this must feel to you. I know I'm not experiencing it, since I'm not going to ever pretend that I know exactly how you feel, but I see you, and I want to help understand this with you. That kind of dialogue goes a long way. But when was the last time you heard your regular GP use words like that? It's not hard to use them. They're easy words. And if you're doing this for the right reasons as your career choice, it's actually not hard to say it from your heart too, because this is why you're actually here. It's just these women have not heard it. So again, they go down these other pathways where they're getting caught up in these marketing loops where they're making these purchases and choosing not to include you anymore in their care. When you go into the room with the patient and you have to be in and out of that room in a very short period of time, and you don't have enough bandwidth as a human being to actually listen to her, you're not going to be a good doctor in that moment. It's just not going to happen. If you enter into that space with an open mind, a curious mind, a desire to do the right thing by that person, when you go into that space and you're not limited to that 15-minute window you're permitted to have, when you go into that space and you're able to run the lab work that you think would be effective for this person, you're not being limited by an algorithm that was handed to you by an insurance company, then you're being able to practice real medicine. See, MAHA thrives because conventional medicine left a wound unhealed. And MAHA and alternative medicine will continue this growth until you take a moment and acknowledge that wound and heal it. Alternative medicine shouldn't be abolished. Alternative medicine should be understood and respected on the part of conventional medicine. They should have a healthy relationship with each other, not antagonistic. Alternative medicine can respect the need for lab work and validation and verification. And conventional medicine can understand the need for alternative medicine in the sense of spending more time in the room with the individual and validating them and caring for them. This doesn't have to be a binary thing where it's either one or the other. This can be a healthy synthesis between the two. I hope this series on MAHA helped and MAMA helped. I hope this puts a little bit of light into why it is that we have such a huge divide in medicine, not only in America, but I know it's around the world. This is an issue out there. I think that I was uniquely qualified to do this because I sit in the middle of both. You know, I'm a physician, uniquely trained to do this type of medicine, and I'm licensed at the level I am in order to provide this level of care. So I think that I have a unique voice in here because I sit in science and I'm trained deeply in alternative, and this is how I work. I understand both, so I hope it did a good job. To the degree I did, please like the episode. And to the degree you like what we're doing here, please subscribe. And then if you know someone that would benefit from this episode today, please share it. Thank you so much for tuning in. And I will see you at the next episode where we're going to start a whole new series.